Hi everyone, Claire here. I'm Head of Partnership at Hub Cymru Africa. Welcome to the second session of the second day of the Wales for Africa Health Links Network Conference. It's been a great conference so far. We've got 7 more sessions over the weekend and on Monday and Tuesday to keep you all informed about global events and links between Wales and Africa, and kind of best practice and other things like that. So I would encourage you to look at the rest of the programme if you haven't already. This event is going to be recorded. We can't see any of you. You'll only be able to see the panellists, but it does mean that you can watch it back, or you can share it with colleagues or share it through your platforms, so more people get to see it. We decided that this session would be quite an important one. We're approaching the Welsh Parliament or Senedd elections in May 2021, where we'll be getting a new government of some makeup. So the kind of policies that go forward with the government are really important for the way international relations happen and the way our health systems and healthcare happens, as well as how we kind of work in partnership with other countries. We're really, really excited that every party has put forward a representative to speak on the issues today. We're also really lucky to have been joined by Garry Owen, the BBC Wales or BBC Radio Cymru journalist. So he's gonna chair it on our behalf because he's more experienced in this kind of live debate. I'm gonna field questions. So if you'll notice at the bottom of your screens, there's an ask a question box. So please feel free to pop questions in there. If we've got time at the end, we'll answer some of them. And just say also, we did invite Brexit Party as well, but they didn't respond. So we haven't platformed them. There's just been no response from them today. So I'm going to hand over to Garry to kick things off. And I'm going to disappear from screen, but I'm still here monitoring the questions. And can I also ask that people are respectful in the chat box and respectful with their questions? We want a positive and participatory event. We don't want anyone to come away from this feeling negative. Thank you.
Well, diolch yn fawr iawn, Claire. Thank you very much. Pnawn da chi gyd, croeso cynnes iawn i chi. Very, very warm welcome to you all. It's a bit of a different event this year, isn't it, really? I'm feeling a little bit like Starship Enterprise here, but I'm sure we're going to fly through it, no worries. I am crossing everything, but feeling quite hopeful. At least we've got all our panellists here, which is very, very encouraging. You know, we live in a world that's changing rapidly. I needn't remind you all of that. And this year has been quite an incredible year for many, many reasons. So this afternoon, let's get together, see where we're at as regards global health and see where we're going, what our hopes, what our aspirations, what our fears, what our concerns are. Diolch yn fawr iawn i Hub Cymru Africa am ofyn I fi gydeirio sesiwn. Chymod, mae'n fraint, mae'n anrhydedd. Y tro cyntaf I fi weithio ar Crowdcast. We've got a first here. I don't know about the other panelists, but Crowdcast is new to me. Oh, there we are. So we're treading new ground. We'll see how it goes. But I'm hopeful, and I hope you as an audience will enjoy the discussion here this afternoon. We're going to be listening closely to what you say, members of the panel, and we're going to be talking about Wales's role in the world and global health. Do you know, I've covered many stories during my long career, 40-year career as a journalist, but one story really stays out in my mind when I went to cover the link between Wales and Lesotho in southern Africa, the small mountainous country. I went out there first in 2005. It was the Glen Eagles Summit, and the slogan was "Make Poverty History." That was the big slogan in Glen Eagles. So I went out to Lesotho to see how big a problem poverty was, and I saw poverty, and I also saw the huge problem with HIV/AIDS in Lesotho, and it was a very, very disturbing visit in some senses, but an encouraging visit in others, and met a lot of people that I've stayed in contact with over the years. I went back there a couple of years ago to cover another crisis, drought, and saw the huge problems that still remain in Lesotho. Now, Wales is helping Lesotho. We've got the link, we've got Dolen Cymru and what have you, which is essential and important and interesting and encouraging. What is Wales's role in the world? How much help can we give, and what should we be giving? Those are some of the things we're going to be talking about this afternoon. It's going to be an interesting, hopefully it'll be an inspiring debate, and we're looking forward to hearing from our panel, and of course, as Claire said, from yourselves. So if you've got any questions, contact us. Now let's meet our panel, and thank you, diolch yn fawr iawn I chi gyd, for giving your time. I know it's a busy time for all of you, so we really appreciate your time this afternoon on a Friday afternoon. So diolch yn fawr iawn I chi, a chroeso cynnes iawn, a very warm welcome to you. Let me introduce them. We have Stephen Doughty, Labour MP for Cardiff South and Penarth, Shadow Foreign Affairs and International Development Minister. We have Jane Dodds, Leader of the Welsh Lib Dems and former MP for Brecon and Radnorshire. Darren Miller, Welsh Conservatives, member of the Senedd for Plaid West and Shadow Minister of International Relations, and Dr Garry Lloyd, Plaid Cymru, Senedd member for South Wales West and Shadow Minister for International Relations in the Senedd. A great panel. I'm looking forward to your company and looking forward to hearing your responses and your answers to some of the questions. And as I said, if you're listening at home or wherever and you want to contribute, you want to ask a question, croeso cynnes I chi. Very warm welcome you to contact us. Let's start by hearing from each of the panelists as to their thoughts. How do you feel about 2 minutes, members of the panel? 2 minutes each, max, no more. I have got my trusty stopwatch. I'm not sure what I'm going to do if you go over time, but it'll be nasty, I can assure you, right? But I'll give you 2 minutes each, okay? To set the stage, what are your thoughts on the theme this afternoon, Wales's role in global health? Stephen Doughty, what do you see as Wales's role in global health?
Well, thank you very much, Garry, and thank you to Hub Cymru Africa for having me on today. And I'm the Shadow Africa Minister, as you said, in the UK Parliament, but also had a previous career in humanitarian affairs, previously head of Oxfam Cymru and other organisations. So this is something close to my heart. And I also chair the all-party group on HIV/AIDS in the UK Parliament, one of the longest established groups. And I would say three things really. I think firstly is to set the kind of context of global health. I mean, you know, this pandemic's made us think about this more than anything else. But I think it's worth remembering that although COVID has significantly impacted in Africa as well, we need to recognise the secondary health challenges. We saw this with the Ebola crisis. You see a diversion of resources, you see a diversion of focus, and actually, given the huge health challenges that remain, whether that's from HIV, whether that's from TB, whether it's from malaria, deaths in maternity, childhood diseases, neglected tropical diseases, a huge number of challenges that remain. And unfortunately, COVID has come on top of that, as well as, of course, challenges of food, nutrition, food security across the continent. And that's why it's absolutely crucial that as a United Kingdom, that we remain our key role. We've always been a big player on global health, actually, under numerous governments. But unfortunately, I think there are a few challenges now. We've seen this merger of the Commonwealth Office and Department for International Development. I think that was a mistake. I think it risks downgrading the role that we play on these issues, which is not just money, it's our influence, it's our diplomacy, it's our expertise. And then crucially, in terms of Wales's specific role, I think there are three things really. I think firstly, we've got a huge amount of expertise. We've got a huge amount of brilliant organisations that advocate, highlight a number of challenges. And we've got a huge role as a sector in Wales as well to educate and inform. And I think, you know, this crisis has taught us anything more than anything. Global health matters. It doesn't respect borders. And if we think, you know, we have a duty, a moral duty, I believe, to our fellow citizens on these issues globally. But we also have to remember that disease respects no boundaries, and the consequences will affect us all in years to come as well. So we've got to retain that role. We've got to retain that key focus.
Okay, Stephen Doughty, thank you very much. Do you know what? You were lucky. I forgot to set my stopwatch. So I think you might have just gotten over 2 minutes there. But the other panelists won't be quite so lucky, I can assure you. And you were talking about some issues there that we will come back to during the course of the debate, I'm sure. And welcome to your cat as well to the discussion this afternoon. Jane Dodds, we're living in a complex global picture at the moment. What do you see as Wales's role in international and global health?
Wel, diolch yn fawr iawn hefyd I Hub Cymru hefyd am y gwahoddiad I ymuno â chi prynhawn yma. Thank you very much for the invitation to join you this afternoon. Yeah, just I'm sure we're all going to be talking about similar things, but I just wanted to raise one specific issue, and you won't be surprised to know that it relates to the makeup of this panel. Nothing against people on this panel, but as the only woman, I just want to talk about equality and gender equality and how we need to be looking at that issue specifically across the world, because we know that women and children suffer more in terms of poverty and health inequality than any other group. So some ideas here, some statistics. I was just looking at global gender gap. The global gender gap in terms of equality looks at health, education, work and politics. Did you know that the 9th country on this list is Rwanda? The UK comes in at 21 and the USA at 53. We're topped by the Scandinavian countries. But let's just look at what we can also learn from Africa. And that's what I want to be thinking about a little bit this afternoon. This is two-way. It's about us learning, and it's about us picking up as well what the brilliant practices in terms of Africa. And what I want to also highlight is some of those African leaders that have been women. We've had a gap now in terms of women political leaders since Ellen Johnson Sirleaf left Liberia, but we've just had another one elected in Gabon. And that's something that we need to be taking forward in terms of the health field, how we can model female leaders, leaders from different backgrounds, leaders with different experiences, because that's about equality. And if we can start thinking about equality, we can be looking at health equality, and we can be looking at addressing poverty. Diolch yn fawr iawn. Thank you.
Diolch yn fawr iawn. Now then, I'm going to go to Dr. Lloyd, but I really don't want to be talking to the Artex on his ceiling, so hopefully I can see his face. That's a vast improvement. Now then, Dr. Lloyd, how do you see Wales' role in global health?
Well, with apologies for some of the gremlins in my system, obviously, this is one of the reasons why we need actually more powers in Wales, plainly. But anyway, by the way, fundamentally, in Plaid, we see Wales should aim to play a greater role in international affairs, really, rather than any diminution. And as regards international cooperation, global health, as we've heard, I mean, this pandemic is no respecter of boundaries, as we've heard, and we need to be helping one another out. We should have been treating African nations as equals, willing to tap into the knowledge they have about how to tackle Ebola. It's very much a similar situation to what we've got now with COVID. We didn't tap into information other countries had about SARS. We decided to go it alone, basically, in Western societies, and we're reaping that. Now then, personally, I know of many, many organizations at a personal and a charitable level in Wales that are linked with Africa. There's an awful lot of stuff happening on the ground, regardless of what government decides to do or not do. I agree with much of what has been said by the two previous speakers. Obviously, there's about over 900 organizations in the sort of health and care and economic development field in Wales that are linked in some way to different African nations. I know particularly of Zambia, because I have personal links with Zambian hospitals, and Lesotho that we heard from Garry, that has been involved with medical societies in Wales for many years. So yes, it's an issue for all of us. We're all involved, and everybody's voice needs to be heard equally in terms of tackling poverty, social injustice, climate change, and this pandemic. Diolch yn fawr.
Diolch yn fawr iawn, Dai. Darren Miller, you know, when we talk about global health, very often we're talking about international partnerships, cooperation, international cooperation. I'm just interested to know what goes through your mind when you think about global health and Wales's role.
Well, thank you, Garry, and it's great to be able to be here with Hub Cymru, and I'm really grateful for them making the arrangements for today's conference. It looks like it's been an exciting and packed day already, and I know you've got some more sessions to follow. I think my first reflections are really in the context of when I first joined the Senedd as a member back in 2007, there really was not a great deal of international relations stuff taking place. And the advent of the Wales for Africa programme really did change that. And it was a much more prominent feature on the Senedd's agenda. And it's been great, really, to see civic society, the public sector in Wales, and the Welsh Government sort of pulling together to do what we can at a devolved level without responsibility for international relations or foreign affairs, engaging in a meaningful way in sub-Saharan Africa. I just wish that our impact could be beyond sub-Saharan Africa. Sorry, I've got a bit of an echo if I sound a bit... I'm going to take my earpiece out because I think it may be clearer.
You're sounding okay from our end, so, you know, I mean, we're quite happy if you just carry on as you were, because sound-wise it's fine. But I think you're having a bit of a problem with, perhaps, it is off-putting when it comes back in your ears as an echo, I can appreciate. Okay, and I think you've been muted now as well. And I think I can see 3 mute signs on the screens in front of me. And the only person who isn't muted for some reason is Stephen Doughty, and the cat, which is interesting. Let me just see if I can just get Darren Miller back. Oh, he's reconnecting, so we'll see where we go there now. And
there we go. Is that any better?
Yeah, we've got you back. That's excellent.
Yeah, so I've got a bit of an echo in my ear. So if I look a bit distracted, it's because I'm talking into my own ear, which is unusual. So yeah, I think it would be great if we had a Wales for the world sort of agenda.
Okay, well, this is the joy of live broadcasting, ladies and gentlemen, especially on a platform that's new to most of us. But now you're looking good. Let's see if you're sounding good as well, Darren Miller.
Okay, we'll give it one more try.
Sounds good.
So I think it would be great if we could have a Wales for the world agenda. It's been great to have that focus on Africa for a number of years now. But there are parts of the Middle East, Asia, Latin America, other parts of the world, I think that we've also got those civic links to, that I think with a little bit of support from the Welsh Government, we could really help to have some new health partnerships in those parts of the world as well. And you know, frankly, I want to applaud the Welsh Government for the work that it's done in promoting the Wales for Africa programme, because I do think that it's something which has achieved success because of the cross-party nature of support for it. And, you know, you've mentioned some of the success that Dolen Cymru has had. You know, there's Love Zimbabwe, I think was referred to as well by Lloyd. And I think the fact that we've got these sort of twinning arrangements, we've got these links between experts in each of these African nations, and we've been able to have a real impact, certainly in terms of developing professional skills and exchanging knowledge, has been really quite tremendous on a very limited budget, of course.
Great. Well, thanks to all the panelists there for starting the debate, and thanks for your comments as well. I can see some starting to come through now. Keep them coming through, because it's really good to have your thoughts on this issue. And if you've got any questions, I'm sure the panel will be happy to respond. So contact us as we go along. Diolch yn fawr iawn I chi. Obviously, we've got to talk about the situation we're in at the moment as regards to the pandemic, and the situation is getting more serious day by day, really. And lots of us are talking about the management or the control of infectious diseases now, and that's very much on the minds of a lot of people. And with our world shrinking, I'm just wondering how important the panel sees the role of international cooperation in tackling the pandemic. Jane Dodds, how important do you feel that countries pulling together are now to deal with what we're facing in the wake of COVID-19?
Well, I think we're all probably going to be singing from the same hymn sheet here. You know, it's so important that we all work together, because, as we've heard, you know, a pandemic is no respecter of borders. We all have to be working together here. One thing that I just wanted to focus in on is pharmaceutical companies, making sure that when we get that vaccine, that is available globally, that there are no price barriers there, and that we take a lead role in the UK and in Wales possibly as well. If that happens, then we have to challenge those pharmaceutical companies to make sure, particularly if they're based in this country, that we make sure that we tackle them and ensure that those vaccines and other medicines are available all over the world, that there's no barrier, there's no poverty issue here. We have to make sure everybody has the access to exactly the same thing in order to challenge the pandemic.
And when we're talking about the pandemic, we're talking about health issues, but we're also talking, Stephen Doughty, about economic issues. I was yesterday interviewing a pub owner up at the top end of the Swansea Valley who was really worried about the impact on the economy and on his business. And, you know, there's a link, isn't there? The economy and health. How do you deal with that? How do you deal with, you know, the challenges that we're facing? Because it's going to be huge, isn't it?
Absolutely, and I think we actually have to go back as well and look at the handling of previous pandemics and global health crises, and the one most close to my own heart is that of the HIV/AIDS crisis. And you mentioned it as well, Garry. Many of us spent time in Africa in the 1990s or early 2000s, just saw with our own eyes the horror of what was going on, and the tragedy that treatments were available, antiretroviral treatments were available, but they weren't available to people living in many African countries. And the reality is that what Jane said about pharmaceutical companies, about global health equity, about sharing of expertise and resource has to be a focus for all of us, because one of the greatest tragedies would be is if we get a vaccine for COVID-19, if that's not made equitably available across the world, and there's delays of 1, 2, 3 years, and as you say, not only the direct health consequences but the economic consequences. And we've got to remember that in many, many countries, not only do they have health systems that are nowhere near as supported and strong as our own, but also they don't have the social protection and economic safety nets that we thankfully do have. And we've already seen the huge challenges responding to the crisis in our own country. In some places this is a double, triple whammy. And I think of places like South Sudan. I've spoken to people from there the last few weeks who were dealing with not only a conflict, they were dealing with severe poverty. They're dealing with multiple issues related to disease and health, a locust invasion, a failed harvest, and now COVID on top of this, and a government that is inherently unstable. That's an incredible, difficult situation to deal with.
And I'm just wondering, Lloyd, is there a danger that possibly we might be looking at a situation where the economic effect of the pandemic might eventually end up in seeing more people dying from the economic effect than even from the effect of COVID-19 itself?
Well, it may well be, and that would be disastrous. But in terms, certainly within the African context, as everybody's mentioned, it is about international cooperation. I mean, Africa, Sierra Leone, and other nations that have had Ebola and have overcome Ebola can certainly teach us a thing or two how to overcome a COVID pandemic as well. But we have things like malaria and TB and measles, yes, and HIV that we're largely under control or have eradicated in Western democracies, yet are still very much alive and kicking literally over the African continent. So it is very much about sharing and cooperation. And the point about big pharma is important. We have the drugs that sort out malaria. We've had them for years. That's why it's quite rare to have a case of malaria in Western society. But millions are dying in Africa for want of those drugs. Now then, there's a sort of social justice point and an inequalities point here that needs to be tackled, and international cooperation is key.
Right, Di, we're struggling a bit with the line, but I think I got the gist of it. And especially, can I pick up with you, Darren Miller, about the last point that Lloyd was raising there, inequality, which is pretty crucial here, isn't it? How do we ensure equal opportunities for people when it comes to health? And we get rid of the mute. I think you're on mute, Darren. Either you muted yourself or somebody else has muted you. It's interesting, isn't it? These little logos cropping up all over the place. Di is quiet. And you're also quiet, unfortunately, Darren. You're reconnecting. Okay. And that worked last time, didn't it? Excellent. How do we ensure equality? Because that seems to be a huge issue in this debate as well.
Well, I think it's been great to see the significant investment that the UK government has made into wanting to develop a vaccine in the first instance. And of course, we're a huge contributor to the World Health Organization as well. I think the second largest donor to global health after the USA. And, the more that we can do to invest in these countries in order that we can support them to be able to distribute the support that people that are suffering either with the coronavirus or some of the other diseases that we've already mentioned, the better. Now, one thing that we do need to ensure is that research funding, in particular, in terms of the capacity we've got in the UK, is maintained, because the UK government has obviously been trying to work very closely with the pharmaceutical industry to invest in their capacity to ramp up the speed at which a vaccine can be delivered. And I think as a consequence of that, the public effectively own whatever vaccine is actually going to be available at the end of the day. And we've got to ensure, therefore, that there's significant public benefit that's derived from it, not just on our own doorstep here in the UK, but also around.
3:30. We've got about a half an hour left on the debate, and we're welcoming your questions. And actually, I'm going to go at one of your questions now. Paul, thanks very much for this one. Jane Dodds, when we consider our relationships with African countries, asks Paul, how do we balance what's in the best interests of Wales and the best interests of the African country? How do we balance what's in the best interests of Wales and the best interests of the African countries when we consider our relationship with African countries?
I think that's a bit unfair to start with me, because I think it's such a difficult question, that, isn't it, really? But I think it is about saying that if we take the approach that we're all working together, then we don't say this will benefit us and this will benefit you. It has to be that we have to look at the benefits for all of us. And it's a bit like a mixing desk for me, that it might be that we're looking at this benefit happening for this country now, and this benefit happening for another country. I do also want to say something here as well. I'm sure, it's obvious, but we sometimes can treat Africa as one country. It's not. It's a continent. It's made up of countries that are so different and so diverse. I've done some work in about 4 or 5 of them. I'm a child protection social worker, and I've had the privilege of being to 4 or 5 countries in Africa, and they're all so different. And we have to keep reminding ourselves of that, and also we have to keep talking to people about that, and using the word educate people around that, because I think there is a role for us all to be raising awareness that Africa is made up of so many countries, of so many different backgrounds, ethnic groups, kind of geography, levels of poverty, etc. They are so different. And as Stephen says, some sadly are shocking, still in terrible war situations. Some have been in war situations. I went to Rwanda, and I was amazed at Rwanda as a country and its move on. But let's try and think, how do we look at the kind of balance here? And I think it is, for me, about having that debate, having that discussion, and being open and seeing it as a two-way kind of traffic, which is where I started.
And I can see Stephen Doughty nodding to that. Is that how you see it?
Yeah, I mean, Gary, it's not an either-or choice, and fundamentally this has to be about the common interest, the common global interest. We're talking about global disease, we're talking about climate change, we're talking about human rights, we're talking about peace and stability. This hasn't got to be about what's good for us or good for them, or trade-offs. I believe there's a moral duty on all of this, let alone sort of the common interest. But I actually think it's in Britain's and in Wales's national interest to lead on tackling some of these challenges by working in partnership. And what Jane said earlier on was absolutely right. This cannot be some sort of clientelist, sort of neo-colonialist agenda either. We've got to be listening to Africans, to African governments, to Pan-African institutions as well. The diversity point that Jane makes is absolutely right. But I've been on calls in the last few weeks with, for example, John Nkengasong, who's the head of the African Centre for Disease Control. Some of the things that have been done on an African Union level in response to the COVID pandemic, actually, we ought to be sitting up and listening to some of the lessons that they've had and the speed at which they were able to get PPE or testing out or key systems in place, despite substantially fewer financial resources and often huge logistical challenges. And there's a lot we can learn and should learn, for our own countries as well. And I take that back to my Oxfam days. We used to use principles learned in work in developing countries with Oxfam, and actually applied them to deprived communities in Wales. And I think we've got to turn this whole relationship on our head. It's in our common interest.
I'm going to bring in Catherine here. Catherine Thomas was sent in an interesting question, and I think I'll put it to each and every one of you, actually. Catherine says the Welsh Government budget for the Wales and Africa programme hasn't significantly increased over recent years, and we don't have an international development strategy. Unlike Scotland, says Catherine, which has a strategy and invested hugely more money. Would your party be in favour of doing what the Scottish Government has done, says Catherine Thomas. Darren Miller.
Well, there is an international relations strategy in Wales. It is something which was developed in collaboration with stakeholders. The Welsh Government, to be fair to it, did a lot of listening when it was developing that strategy. And there has been concern that the Wales for Africa budget line in the Welsh Government's budget has not been sufficient to be able to build that extra capacity that I think all of us want to see in terms of links. I think the incredible thing about the Wales for Africa programme is just how far and how much of a reach Wales has been able to have with a relatively small budget, and that's why I think there is a growing appetite for new partnerships to be forged, because these relationships are just so enriching for everybody involved. They're enriching for health professionals, some of whom will be delegates to this conference, who've been able to go out, participate in professional development sessions, meet with their peers, learn new things for themselves, develop their own skills, and come back. And I for one want to see more people having those opportunities. And I think that an expansion of that budget line is something which is very, very desirable. The Welsh Government, of course, will be publishing its budget in the very near future for next year. It'll be interesting just to see what happens and whether it goes north of where it is.
Should we be doing more, Lloyd? Should we go bigger?
I'm sorry, I didn't quite catch that.
Sorry, I was just moving on. No, Darren, thank you for that. I was moving on to Lloyd next to you in my screen here. Should we be doing more, Lloyd? Should we go bigger? Reconnecting. Okay. Stephen Doughty, should we do more?
I think the Wales for Africa programme has been incredibly successful and absolutely should retain, its status. It's a challenge between the sort of the beauty of letting 1,000 flowers bloom, and we've been absolutely brilliant about that. Punching above our weight in some of these relationships, particularly with certain key countries. I think of Lesotho, Somaliland, Uganda, many places where Malawi, really strong links between Wales, those countries. I think it's been absolutely brilliant. But we also have to accept that often the best work is done working through multilateral organisations, through sort of shared pooling of funds and expertise. So it's about that balance between those two things. But the one thing I would say is that, given the record of success, and this should be a broad consensus on this panel, but I have been really concerned to see the comments being made by Darren's leader today, saying he wants to scrap the international relations minister in the Welsh Government and scrap, pick apart the department. I'm reading his words directly from his speech today, and it's really disappointing because I know Darren is committed to these issues. I know that there are many across the political spectrum who are. And we've seen some of that going on in the UK Parliament as well, where there's always been cross-party working on these issues and commitment. And sadly, some of that is starting to fray because people want to sort of play political games with it and make it into an us or them thing. Let's just keep everything at home.
Let me just bring Darren Miller on that. And Lloyd, I can see you're back, and Jane Dodds. I haven't forgotten about you, but I'd just like to hear Darren Miller's response to what you just asked there about comments, I think, by Paul Davis. As regards international development. Darren Miller.
Well, Paul Davis was making it clear that the Welsh Government and the UK Government agreed to have a respect agenda around the boundaries of the devolution settlements. And for the past few years, we've seen that respect agenda being under pressure. I think it's fair to say, largely, frankly, as a result of the whole Brexit debate. What Paul Davis wasn't saying in his article today is that Wales shouldn't have international relationships and that we shouldn't have our Wales for Africa programme in any way, shape or form. So I just want to reassure your delegates that the Wales for Africa programme is something that our party absolutely supports.
Doing is more effective than talking and meeting, says Trevor Palmer. And Lloyd, he's probably right, isn't he? Hello, Lloyd. Di's looking very, very comfortable there, but I don't know if he's hearing my questions. But let's see. Let's try once again. Hello, Lloyd in Swansea, I think. Possibly not hearing me. Oh, well, there we are. What do you think, Jane Dodds? Yeah, doing is more effective than talking and meeting, says Trevor Palmer.
Yeah, well, before I saw that, I was thinking the same as well. So strategies are really important, but the key thing for me is that we do need to be doing things and we do need to be delivering. So I think the key thing here is that we want to look at what unifies us, particularly what unifies us across politics as well. And I think what you've got here is a panel of people who are committed totally to seeing things change, to seeing us maintaining a really strong link and developing and strengthening that link. So really what I would like to see, and I'm learning things as well through this debate, it's I don't come to the table here knowing everything. So I want to go away and I want to go look at this, but I do want us to be doing things. I want us to be looking at resources. I want us to be looking at budgets. I want us to be looking at finances, because we do have to make sure that we develop our capacity to deliver, and our capacity to deliver is only backed up by money.
Do you know, it's quite interesting watching the four of you, because the picture quality with some of you has improved drastically during the course of the debate. I'm hoping now the sound quality is going to improve with Di as well. Can you hear me now, Di? I'm still having a bit of a problem, which is unfortunate. We will come back. Di, I've got a very clear picture of you, but I'm not hearing you very clearly. Let me just put this to Darren Miller, Paul's point here that's just come through. Thanks, Paul. In response to the question of who benefits, Wales or Africa, should we be using words like solidarity as well as development? Development can indicate a catch-up mentality, whereas solidarity starts more easily from equality. Did you catch that, Darren?
I did catch that. I've seen the comments from Paul in the comments box. I think we need to be using words like partnership more actually. I think that's the emphasis that there needs to be on these things. We know that some of the health systems in sub-Saharan Africa, as has already been said by a number of panelists, are in need of significant improvement, and we can partner with those nations in order to make a big difference.
Yeah, and that wasn't great sound quality wise, but I did get the gist of it, so I'm not going to ask you to repeat it. But no, it's fine. It's fine. I think moving an inch away from the mic makes a huge difference in this technology. Yeah. Try again.
It's. I was saying that I get an echo when I speak, so I'm having to lift it away. But I keep it there. Can you hear me? Okay? Is it clear?
Yeah.
Great. So I was saying that I'm not sure solidarity is the right word, but certainly partnership is a word which I think we should be using much more strongly. We know, of course, that some of the health systems in some of those sub-Saharan African countries are not as sophisticated as the health systems over here with our NHS. But I think that if we adopt a partnership attitude towards improvement with those nations, then we can go great guns at making significant improvements, as we have done in places like Lesotho.
Is there a danger, Lloyd? I hope you can hear me now, and perhaps we can hear from you as well. Is there a danger with so much focus now on domestic matters? Is there a risk that we're going to lose sight of the wider picture, the sort of thing that so many people listening to this debate this afternoon, and you as panelists are obviously passionate about? Are we going to lose that wider picture because of the focus on the domestic issues? It's a shame. I'm not quite sure what we're going to do about that, Di. We'll try again. Perhaps disconnect and reconnect, Di. Perhaps that's the way around it. Perhaps we'll try that and see where that goes. Is that a concern, Stephen Doughty? Is that a worry for you?
Yeah, definitely. But just going back to that point about partnership as well. And so let's not forget, this isn't just about governments. And actually, one of the things that the Wales for Africa program's done very successfully is actually empowering the civil society to civil society links and the community to community links, which are incredibly powerful, both in terms of people and finances. Actually, so I think the contribution that diaspora communities in Wales make to countries where they have family, friends and others is remarkable, often dwarfs aid spending. I think of the examples of Somaliland. One of the most fantastic health advocates I've ever met in my life is a woman called Edna Adan, who set up an incredible hospital I've had the pleasure of visiting in Hargeisa myself, and her close links with the Somaliland community in Wales, and funding for different projects. It's not all just about governments as well. And I think you're absolutely right. I mean, there is a risk with the current crisis that people turn in on themselves, and I think we've all got to be bigger and better than that, because these challenges are not for one country. They cross borders, and if we turn this into a sort of a narrow-minded agenda, we will not only fail in our sort of duties globally, but actually we fail ourselves in the end as well.
And also, is there a danger, because of the pandemic, which is where we started the debate this afternoon, that a lot of issues are going to be rolled back as regards health? I don't know, where's it going to leave us as regards, I don't know, screening or women dying in childbirth and these sort of issues that are so important? Is there a risk that they're going to be put to one side now?
Yeah, absolutely. I mean, I spoke the other day with the head of the Global Fund for HIV, TB, and malaria, and he warns us that we could see a decade reversal of the progress that there's been on some of those diseases, which would be absolutely devastating. And that's why their support for their programs is going to be so key over the weeks to come.
Yeah, and Di Lloyd, I see you back with me. Can you hear me now? Hello, Di. Can you hear me? It's a shame, but you're shaking your head. So can you hear me, but you can't connect, or what? You can't hear me. Okay, sign language here, but it's working. It's obviously. That's a shame. And we had a little run through, and everything worked out really well. But that's how it goes. It's the nature of the beast, ladies and gentlemen. Unfortunately, apologies for that. We'll try and get Di back before we finish at 3:00. It's not just partnership, says Paul, but equal partnership. Well, yeah, equal partnership, which takes us back to a point we raised at the beginning, really, isn't it? How do we ensure equality? And that's a huge challenge. And talking about challenges, I mean, another challenge is climate change, and we haven't touched on that yet, but obviously it's part and parcel of this debate. Darren Miller, how do you see that?
Well, it's a huge part of what we continue to need to partner with these nations in. I mean, it's been wonderful to see the significant environmental improvements through tree planting, for example, that have taken place in Uganda as a result of the Wales for Africa programme. And of course, that will have a huge impact on, yes, the environment, but also on people's mental health, on their physical health, as well as as those trees develop and grow and help to change microclimate around them. So I think it's very important that the Wales for Africa programme also has an environmental focus, because the environment has an impact on people's health. So if we ignore it at our peril.
I should apologise again about the problems we're having with Di Lloyd, Plaid Cymru's sound this afternoon. I have had a note that he will be speaking on these issues tomorrow at the Plaid conference, and they'll be shared on Hub Cymru. So sorry about that, Di Lloyd, but I do appreciate it. I think you're moving on to some other meeting now, but thank you for your time, and apologies to everybody for the problems that we had there. But as I say, these things happen, and I'm really grateful that the remaining panelists are still with me, because it's really nice to see their faces as we continue with the debate. Climate change is a big conference next year, supposed to be in Glasgow, isn't it? And we're going to be hearing talk about development aid and Africa interlinked to climate change. How high is it on your party's agenda, Jane Dodds?
Well, it's very high on our agenda. It's a theme running through our manifesto, but I think it is thankfully, it is on every party's agenda. And we need to be continuing to push it up the agenda. One thing that I do want to talk about, though, in terms of our global kind of commitment here, is our treatment of refugees and asylum seekers. That is a huge issue. If we think about it as a global commitment to those people who are escaping persecution, but are also, looking at how they can get away from war-torn situations. And our treatment and welcome of those is really critical to the way that we are seen as a global country across the UK, but here in Wales. Now, in Wales, we are absolutely a nation that welcomes people from different countries, and we've all seen that in our own communities. I do think it's a shame that we're seeing a little bit of a kind of a rhetoric from the government, and I'll be really party political here, that really concerns me and frightens me. And I really want to row back from that, because where we need to be is in a place where we're welcoming people, where we're seeing the value that they bring. It doesn't matter what their qualifications are or their backgrounds are. And I, like others, will know people who are working in restaurants, who are driving trucks, who are serving at tables from different countries, who are qualified to be working on our health professions, and they can't work. And that's ridiculous. We've got to change the law right now to let asylum seekers work. That's one thing, as well as welcoming them.
Can I just come to this, because I see we're on 10 to 4 now, and the clock is ticking, so to speak. Though they tell me they're not going to kick me off, which is quite interesting. But if we do overrun, we're okay. There's no weather I've got to go to or anything. A dead on 4 o'clock today, so I've got a little bit of free reign here to play with. We've been talking about the interconnection between the economy and climate and health. And our population is really interconnected these days. Look at this now: Crowdcast, Zoom, and what have you. And one thing I'm hearing a lot of people talking about in that context is lessons we've learned from the pandemic, what we've learned from the last 9 months, and how we can make sure things like this don't happen again, or that we deal with them perhaps in a different way again. What do you think we've learned about international collaboration? When we're talking about global health here today, should this happen again? Darren Miller.
I think we've learned a huge deal. I think, there's nothing like a pandemic to wake people up to the importance of international cooperation. And it's been fantastic, really, to see that the channels which did exist already have borne some fruit, but also to see the renewed emphasis, I think, on the need for international collaboration too. I mean, one of the great things about the Welsh NHS is that it really does international cooperation very, very well. I mean, Public Health Wales has got its own international health strategy. It's engaging with partners around the world, not just in sub-Saharan Africa, but also elsewhere. And I think, we need to have more organisations, particularly public sector organisations, doing that. There's not enough, frankly, learning that goes on between local authority organisations in Wales and their counterparts overseas. And I think, we need to get smarter about harnessing the power of that and the impact it can have, yes, overseas, but also on our own citizens here in Wales too.
Catherine Thomas, Catherine, thanks. Thanking the panel for being so positive about our global health commitment in Wales. I'm hearing that we are all proud to be Welsh and to be global citizens. As I said, we've got about 5 minutes. Just perhaps as we started the debate, go back to the three of you, the remaining panelists, and see what you think the priorities should be as regards global health in a post-COVID world. What would be the priorities for each of you? Stephen Doughty, then.
I think, and this goes back to what have we learned from the pandemic as well, is fundamentally is the importance of strong public health systems and publicly funded health systems, not ones that are fragmented or run for profit or run for people to sort of scalp off the back of. I mean, you only have to look, and this is one of the great things that Wales has given to the UK and to the world is, of course, our NHS and Nye Bevan's leadership and what it's done. And I think, if you look at, for example, some of those scenes we saw from the United States, where people weren't leaving their homes to get treatment for COVID and were dying in their homes because they were worried about the bill they would face at the end of their hospital treatment. How lucky we are, despite the tragedy that we've seen, that hasn't been a choice for families here in Wales, and nor should it be a choice for families around the world. And I think the sort of the top priority for me, and always has been, is the importance of strong national public health systems available equitably to all. And that is the foundation of any society, any strong society, as well as a public education system. I think that's the first thing. The second thing is the importance of global cooperation. And, I'm glad to see that the UK has continued to fund the WHO. But again, look at what Trump's been doing on that, trying to break down the very organisations that can work on these things together. And then the third thing is the importance of sharing expertise, research, knowledge, techniques, and that has got to be a multi-way process. And we can, as we've talked about, learn as much from our partners in Africa as they can from ourselves. And I think those are the three lessons I would take going forward.
Listening to you, Stephen Doughty, I'm surprised you didn't go to the pulpit, because it's an old Welsh tradition, isn't it? Ministers, they very often have three heads to their sermons in non-conformist chapels.
I grew up in a Welsh Presbyterian chapel, Gary, so I had it from a young age.
What do you think the priorities should be in a post-COVID world, Darren Miller, when we're talking about health on an international level?
Well, we're certainly going to have to make sure that there's adequate funding for the World Health Organization, and that we continue to be very generous as a UK nation towards that. One thing which I think has been exposed perhaps during this pandemic is the influence of individual nations on the WHO because of their contributions. And, there was concern expressed very much in the early stages that the influence of Chinese funding could have been perhaps slowing the response, for example, to the pandemic. And I think it's really important that the WHO therefore has a very diverse basket of support, so that it can continue the very important work that it undertakes on behalf of the global community, without sort of feeling it has to hit the mute button, because that's uncomfortable for some of its donors.
Well, they're not going to hit the mute button on us just yet, because we've got Jane Dodds to go to to close the discussion on this issue, but also the debate this afternoon. What do you think about the priorities? What are the priorities for you and your party in a post-COVID world?
Well, diolch yn fawr iawn. And I also was raised in the Welsh Presbyterian tradition, so I'm going to be coming up with three things really quickly. I started with the gender equality. Gender equality is so important for me in terms of everything that we do. Secondly, it is about language and about education. It is making sure that we use the right language and we really raise the bar in terms of education. And the third one is resources. We've got to put our money where our mouth is. Thank you very much. Diolch yn fawr iawn.
Diolch yn fawr iawn. Well, do you know what? You've been a perfect panel as regards time, because it's now 15:59. And if I had a director in my ear here, they'd be saying, well done. But you've also been a perfect panel as regards responding to the questions this afternoon. And on behalf of all of us, thank you. Diolch yn fawr iawn I chi gyd. Dr. Lloyd, unfortunately, we had some problems there, but hopefully next time we'll sort that out. Jane Dodds, Darren Miller, and Stephen Doughty, thank you all of you. And thank you, Hub Cymru Africa, for arranging the debate this afternoon. I found it really interesting and informative. And all of you watching and listening, thanks for your comments, and thanks for joining us. Diolch o galon I chi am eich cwmni chi. Ni yn gwerthfawrogi fe. Mae'n bwnc pwysig. It's an important topic, international health development. It's important to each and every one of us, and I hope you found this debate lively and informative. And good luck to Hub Cymru Africa, Claire, all of you, with the rest of the conference. I know you've got quite a few events lined up again, exciting events, and well done for experimenting with the new technology, which we all have to do really under the circumstances we're in at the moment. It's interesting seeing these developments, and you've done really well in organising this conference on a new platform, so to speak. So diolch yn fawr iawn I chi, and good luck to you with your work. Diolch yn fawr.
Thank you, Gary, for joining us as well, and thanks to all the panelists.
Diolch.
Well done on coping with the technology. Thank you. Bye.